Welcome to season 2 of our panel. Thank you so much for joining us. I am your host, Dr. Crystal Redmond, and I'm joined by our two amazing co-hosts and co-panelists, Dr. Rose and Dr. Q. Welcome back.
Thank you so much. Thank you.
Oh, y'all look gorgeous as always.
So do you.
Thank you so much. So I've been really excited to have this conversation, just bringing a space where we can center our communities, our families, and anything dealing with our health and lives. So Thank you for holding this space with me.
Thank you for creating it for us.
Absolutely.
Definitely needed.
Yes, definitely needed. And so why don't we get into it?
Let's do
it.
Wonderful. So as we said, we're in season 2 of our panel. This is our very first episode, and it's centering Black maternal health and infant mortality and morbidity. So just a notice about a potential sensitive topic. There is a lot of information that's going to be discussed here today that is very sensitive. So I want our viewers to be mindful of that while choosing to view our episode or not. But so many things have changed over the last 3 years, our 3 COVID years. So many things have happened. We've navigated the COVID pandemic. We're still navigating it, to be quite honest. We've seen increased exposure of anti-Black racism. However, so many things have remained the same. We continue to see increased rates of maternal morbidity and mortality rates amongst Black folks and Black birthers. We continue to see this increase in mass shootings within schools and increased risk of just anything dealing with any of our health outcomes, right? So why are things still remaining the same? So with that being said, I think it's really important to start our first conversation on Black maternity rates and really looking at the disparities amongst our communities and what are causing the inequities in our healthcare outcomes. So let's get into this conversation. So in thinking about our Black maternity, morbidity, and mortality rates within our communities, I think last season we spoke about so many different facets of the healthcare system that directly influence our healthcare outcomes. And I know since our last taping, a lot of us just have expanded our families, have navigated our own birthing journeys, and have just really not only been working within the system, but experienced it as patients. So we'll get into our personal stories a little bit later, but this conversation, it not only is needed, but just remember, as we're navigating this conversation, we're a part of community too. So we've experienced so many different facets of what a birthing journey and experience can truly look like for Black folks within, or navigating our own birthing journeys. So with that being said, we know that Black and brown folks, specifically Black folks, are 3 to 4 times more likely to die due to childbirth. So let's just sit in that. We're 3 to 4 more times more likely to die as a result of childbirth, period. Okay, and that's compared to any other racial group, not just white folks, but with any other racial groups, we have increased risk of maternal morbidity and mortality just because we're having a desire to increase or expand our families. So Dr. Rose, can you give us a little bit more insight on what the data disparities look like for our communities here?
Absolutely. So there are some stark racial disparities that exist in our country when it comes to maternal and infant health. As Dr. Redmond said, Black women are 3 times more likely to die in childbirth. 3 times more likely. And 84% of pregnancy-related deaths are preventable. And I think this is something that's really important for us to understand. 84% of the deaths that are related due to complications in pregnancy are preventable. But Black women such as ourselves, we continue to be in the statistic that we should not be in. So Black women also are 3 times more likely to be admitted to ICU following childbirth and have increased risk factors such as fibroids. I know personally myself, I had fibroids and I was not aware of this until I actually was pregnant. And so this really increases our risk for a number of morbidities. And when it comes to our children, Black women are more likely to have preterm births as well as low birth rate babies. And this is not easily explained by economics. So you would think the more money that someone has, the more access they have. That is not the case. Black women with advanced degrees have low birth weight babies at a higher rate than white women who do not even go to high school. And so that's something that I think is really a taboo topic. Why do we have these disparities? Why are these morbidities happening, especially to our community?
That's a really good point. Yes, I think we've discussed this before in past episodes. We spoke about weathering, and it really looks at long-term oppression and racism, the effects of racism, on our bodies and how that influences our poor healthcare outcomes. Because as you said, folks who have higher degrees within our communities are dying at increased rates compared to other folks. So it's not merely because we have a higher social economic status, or you're in a different economic category or anything of that nature, but it's really truly taking a deeper dive into systemic racism and what that truly looks like. And when we say systemic racism, we're not just talking about a building, a system, a hospital, right? Like, there are people who make up our systems, and let's just be clear here. We are all socialized into white supremacy. And someone that I work with actually said that to me the other day, that, we are all socialized into white supremacy. Every one of us, right? Regardless of our identities, because of the society we live in. So if you think about taking that on as a provider, and it's perpetuated within the healthcare system, you begin to take on practices of implicit bias and how you treat people based on their different identities, based on their different socioeconomic statuses, etc. So that's a bit of why we're seeing these disparities. It goes deeper into other type of issues, or what have you. But the interesting thing here is not just as we are pregnant or becoming pregnant, our pregnancy journey, we're seeing increased disparities and inequities even after we deliver our babies. And I believe that's similar to some of your experiences, Dr. Q, within your private practice as well.
Yes, so a lot of times I teach my patients and also some of my colleagues of being aware of some of the things postpartum. As Dr. Rose and as you, Dr. Redmond, stated, that Black woman is 3 times more likely to die postpartum. And the reason is because we're so used to pushing through things. So I teach my patients, I teach through social media, and also there's a lot of influencers now that are speaking out. Knowing your body, knowing that shortness of breath is not because you just had a baby, knowing that cramps in your leg is not because you've been up all day, knowing that big clots, bleeding excessively, all of those things you need to seek, personal attention immediately after your baby. And also that these infants are dying just as much as we are. And it's just because the providers are not undiagnosing things such as hypertension during pregnancy and other unknown symptoms that need to be known during the pregnancy. So it is causing a lot of healthcare disparities.
Absolutely. Thank you for that insight. Yes. And you had said something, we're not just focusing here on maternal, specifically Black maternal mortality and morbidity rates, but we're also forgetting our community of infants, right?
Yes.
Like, it's not just we're at risk and we're experiencing these inequities and mistreatment within the system, but our children are too.
Right.
And thank you so much, Dr. Rose, for sharing your story about as you got pregnant, you didn't even know you had fibroids until you became pregnant, right? Mm-hmm. And that's very often the story with a lot of us, right? Mm-hmm. I've shared my story a few times with my son, Amir, who's about to turn 6 on Juneteenth or whatnot. So I know, I'm like 6. Whoa, that means I'm how old? So, but Amir, he was born at 27 weeks. I had undiagnosed severe preeclampsia. Mm-hmm. And here I am, doctor, educated, as we said before in other episodes or whatnot. Socioeconomic status had nothing to do with what was going on here. And you would think I would have known. And I knew nothing. My first pregnancy, had my son at 27 weeks. He was 1 pound, 12 ounces, I believe, and stayed in the NICU for 4 months, fighting for his life, literally. Mm-hmm. And there were moments within his journey that I had to show up as Dr. Redmond. I didn't have the privilege of showing up as a parent concerned about not only my health, because I'm recovering from emergency cesarean, but also my child's health or what have you. And, Amir navigated multiple different surgeries and procedures and everything, but a happy, almost 6-year-old now and such, but it doesn't remove any of the trauma that I experienced in that situation. And speaking about infant mortality, my first time actually sharing on any formal platform is the loss of our, my husband and I's daughter, Ari. We got pregnant in 2021, I think shortly after our wedding. And we had our daughter at 24 weeks, I believe. I experienced intrauterine growth restriction, complications with my placenta, what have you, and was considered high risk just from the start of the pregnancy because of my son. But she was delivered at 24 weeks, lived 4 days, and then unfortunately we lost her. And people don't speak about not only just pregnancy loss, but infant loss too as well. And creating an environment to navigating, that journey was very hard, but 6 months later, we conceived our now rainbow baby, Araya, who is 8 months today or what have you. But so many different things happened there. One, creating space for both navigating grief and joy, because currently, as I am very joyful for this beautiful pregnancy experience I had with Araya. I'm still grieving the experience I had with Ari and not having, Ari too as well. But both can be true at the same time. You can experience grief and trauma and all these different things, but also experience the beauty and joy of pregnancy too as well, and hold space for both. And I think that's what we wanted to do today, discuss the very real factors of what the data and our experiences look like within becoming pregnant and birthing, but also uplift the beauty and the power in our stories of how we can navigate a healthy experience too as well.
Absolutely. And we should have a healthy experience. When you think about pregnancy, it should be considered one of the most joyous moments in a cis woman's life. And so I think for my own story, like knowing other people that experienced trauma, that experienced grief and loss, I knew early on I was going to have to advocate for myself. And so going in, when the healthcare physicians would say, like, you have to do this, this, and this, I'm like, do I?
Yeah,
like
right.
I feel like we need to always be sure that we are advocating for ourselves during our pregnancy journey. But more importantly, we are also our unborn child's advocate.
That's right.
And I don't know how to stress this enough. Like, I would never let any nurse or any physician tell me what I was going to do.
Right.
I would consult my village. I had some doulas, I had friends who were MDs, and I would ask them, like, my doctor said this, what do you recommend? And because they know me, they know my culture, they know my diet, they know me, my lifestyle, they would give me their opinion and I would respect that. They're a credible source. They're someone that I've known for a long time. And so I think it's really important, like, we don't have to do everything that's told to us. We need to do what's best for us and our bodies, and more importantly, our unborn child. And so for my journey, I tell people this all the time, my pregnancy from start to finish was beautiful. Minus the end, which was an unplanned cesarean. I was not planning for that at all. But from start to finish, and I think it's because I asked so many questions. I asked questions from the day that they told me that I was pregnant. I'm like, okay, so what does this mean? But they came in from a very different perspective. Yeah. They said, India, you're 36, you're African American, and you have fibroids. So this is considered a high-risk geriatric pregnancy. Geriatric.
First off, that just
like,
every time.
I'm like, okay, geriatric. And so, I feel like going right in, it was kind of negative, but I chose to, kind of not internalize that. I said, regardless of what you all are saying, I'm going to have a happy, healthy pregnancy.
That's right.
Then they shared, you also have fibroids. And I'm like, wait, what? I had no idea that I had them. They told me two things could happen. Either the baby would put pressure on the fibroids, or the fibroids would put pressure on the baby, causing a miscarriage. And so you get all of this information in one appointment. You're pregnant, you're geriatric pregnancy, and you have fibroids. And so you could possibly lose your baby. So don't tell anyone just yet. It's like, wait, I can't tell anyone I'm pregnant. So literally for 16 weeks, I had to keep it a secret. Only my immediate family knew, my circle. But once I got over the hump, the fibroids eventually, I don't know where they went, they started to shrink. I started with 7, they went to 2, and by the time I gave birth, they were not noticeable or detectable. So that was a beautiful thing. But I feel like our healthcare system, like you said, it's some of those institutional type of oppressors and just the stigma period. I think being a Black woman, regardless, like you said, of socioeconomic status, of education, none of that stuff matters. When we come in, we get a different level of treatment, and that has to really change. So what about your experience?
My first experience, I had the first child when I was younger, didn't really know about pregnancy. My husband didn't know about pregnancy or delivery, and we just moved here. So I was forced for an induction when I wasn't even dilated, or my cervix wasn't ripened or soft or whatever. So I was rushed into induction, and my body just wasn't ready to have her. So I had a cesarean, emergency cesarean? But I switched medical practices. I joined a VBAC group on Facebook, and they're very supportive of
what's VBAC for our people that don't know?
Vaginal birth after cesarean. So I got pregnant when my baby was 1 year old. So I had, kids 2 under 2. So I advocated for myself, and actually it was the village it was a Facebook group, and then I found providers that were VBAC friendly. And I found this Jewish doctor out of Atlanta. He teaches at Emory. I won't say his name, but if you are interested, please reach out to me. But he was an advocate, and he had people of color in his facility. He told me people are scared about uterine ruptures. So I researched that. He checked my cervix and everything. He said, you are safe to have a vaginal birth, and it'll be, probably a healthier experience, because I was having a lot of swelling after my first kid. And I knew that wasn't right. So I went back to the hospital because I just know my body and I'm in that field. Absolutely. But a lot of people don't know that. Right. So I got myself checked. I was fine. It was just I was having a lot of fluid. So I had Faith, which is my younger daughter now, with a vaginal birth. Honestly, it was no complications, but I birthed a long time. Yeah. So I birthed for 30 hours. I'm not even. So anyway, I feel like a dog was laying there. But if I didn't have that doctor on my corner saying, yes, you're right, you're in the right practice, nothing's going to happen to you or your child, I will listen to you. It did wonders, and it made me and my husband feel comfortable, and I was able to labor a healthy kid. And even after, I was able to just feel comfortable. I don't know how to explain the experience, but it felt good for somebody to specialize in something that I was looking for and actually listen to me. So if it wasn't for that village approach or me knowing about those things, but you have to ask around. That's what our panel is about.
That's right.
Establishing options for people who may not know. So Absolutely. I just love this group so we could just advocate for our people.
Absolutely. And you said a few things here. You said having a village, having community, which, obviously this is why we're creating this space, so we can navigate this collective conversation. And this is how you build and shift power, right? And then you said your doctor listened to you.
He did.
Yes. So,
and my doctor is 75 years old. He's very old, and he's a single practice. So, but he's been doing it for years. I'm like, I'm gonna listen to this old man because he made me feel comfortable, guys. This is a Jewish doctor. It doesn't have to be, you have to go to a Black provider, because I'm be honest, my first provider was an African-American woman, but I feel like she pushed it. Right. And not saying she didn't know my body, it's just you also have to go somewhere you feel comfortable. That's right. And that they're, you know what I'm trying to say.
Yeah, absolutely.
But that goes back to my point. We're all socialized into white supremacy, right? It doesn't matter your identity. So you have to feel comfortable. You have to make an informed decision on who you seek for care and who you have in your village. Absolutely. And so I remember being pregnant, or after our loss of our daughter Ari, another provider told me, I don't think you should have any more kids because you may have so much scar tissue, right? You can have so much scar tissue. What if you need a hysterectomy? Like, this is just too risky, right? High risk. You're already high risk. You've already had 2 complicated deliveries, a lot of negativity. And this was on my first post-op appointment. I'm grieving the loss of my daughter, and you're telling me if you plan to have any future children, don't. First, she asked me, or she told me, you should have a surrogate. I said, that's like $100,000. I don't know.
And then she jumped to the last resort.
I'm like, I don't even know if you know what my income look like, but are you assuming? Like, what's going on? And you should just get a cesarean, surrogate, excuse me. Yeah. And so there was a lot of fear instilled into me, and I began to do my own research. I got I think it's called like a 360 doula, a doula that does, a full all-round services from the loss of, a child, or if you want to become pregnant or grieving or whatever it is. I had community midwives. I, had my OB. I had a circle of people that I hand selected, my OB nurse, to really be a part of my journey. And what I did is I went outside. I had the resources, which a lot of us don't. I went outside of my insurance. I have Kaiser, and I actually brought on an IVF specialist, reproductive endocrinologist, and he actually went down a list of tests, and they actually took images of my uterus and found no scar tissue. Wow. So if I would have just, believed in the fear, instilled on that, didn't select my team around me or anything like that, I may not have continued on in my own personal pregnancy journey the way I envisioned it to. So really shifting that, dynamic, that power shift dynamic or what have you, and taking ownership over your own experience and your body, right? Like, bodily autonomy is not really sought or not really uplifted within the healthcare field. So I really want to speak to that a little bit and bring on a guest. I would love to welcome in our guest, Janiqua Friesen, who is a registered nurse in the high-risk department for over 10 years, is a married mom of 5, and whose passion is advocating for women's fertility and women's health. Welcome, Janiqua. welcome.
Hi, thank you ladies for having me here.
Absolutely. Thank you for being here. You look amazing.
Thank you. You guys look all lovely in spring.
Yes.
I know.
I see the pink.
Right.
Oh, I got pink on too. I'm just kidding. Beautiful spring sun.
That's right. That's right. That's right. So thank you so much, Shaniqua, for being here, taking time out of your busy day. I know being a registered nurse in high-risk departments and also being a busy mama of 5 is not something where you just carve out time to be on our show. So thank you so much for thank you so much. This is a very important conversation. One of the things we wanted to ask you is first, what are you seeing with your patients or even in the high-risk department as you're navigating your departmental duties, so to speak, as a registered nurse?
So I've seen like a variety of differences between the two. The main one being our mortality rate. Clearly, you can see just based on statistics and research that Black women are dying at a higher rate than our white counterparts, and it's not fair. And what I'm seeing is like it doesn't matter your education, it doesn't matter your socioeconomic status. It really matters that there's social disparities within our community, and it's being presented in the healthcare field. So I've seen patients treated differently based on just the color of their skin. Take, for example, myself, I have 5 children, and my first one, I was not an OB nurse. I did work in the hospital, but I knew nothing about, OB care, prenatal care, postpartum care, or delivery. So I went in very naive. I was a yes girl to the doctors, whatever they told me, I did. And I did have a preemie. He was delivered at 34 weeks due to preeclampsia, which is also, a comorbidity that is increased in the Black population. And he was in the hospital. I was in the hospital postpartum with complications as well. And then fast forward, I had my other children very well diverse in the field, and I advocated for myself.
That's right.
And the biggest difference for me that I saw between the different deliveries was the care that was given to me by my doctors and the nurses around me. And again, it didn't matter your education because, for example, research also shows that Black women who do have college degrees are dying at 3 to 4 times the rate of a white person with a college degree, and then 1 to 2 times more than a white person without a high school diploma. So
Yeah, it's crazy.
that is, those rates are insane, and we have to do something about it. So.
Absolutely. So tell us a little bit about what you do as an OB nurse. Tell us a little bit about that.
So I've done a variety of things. My first job was actually for at-risk youth and their children, 1 through 5. And I kind of helped them with education, getting them on their feet in terms of like what they want to do in the future. And then I also helped them postpartum. So I was able to kind of educate them on what to look out for as well as what to look out for with their children. Okay. And then fast forward, I've worked on labor and delivery floors, OB floors, antepartum, which means they're just coming in for, care before they deliver. And then I've also worked in high-risk OB home health, which was actually, I think, my favorite because I was able to work with patients from the minute they found out they were pregnant through their postpartum.
That's amazing.
And postpartum is really my main focus because I think a lot of times that area kind of gets pushed to the side.
Yeah, absolutely.
So that was one of my favorite jobs. And then telephonic, which was with the insurance company where OB patients would call in with questions and concerns, and you're able to educate them there. So.
Wonderful.
That is great. I didn't know there was like OB home health, postpartum OB home health.
It's OB home health throughout the journey. So you're actually with them through their pregnancy and
after. That's something I didn't know. So I'll definitely send you that information to some of my patients.
Yes.
So how do we improve outcomes of Black maternal health?
I think the main thing we need to do is educate parents, one, before they, conceive or before they're even trying to conceive, just especially in the Black community. We know what our comorbidities are. We know that there's an increased rate of preeclampsia, eclampsia, and HELP in the Black community. Well, why not educate beforehand?
Right.
Things to look out for. How can we improve this? Our diet, exercise. I know you get a lot of patients as far as like exercise. So, you can teach them what to do beforehand and then throughout pregnancy as well as postpartum, because these comorbidities can show up postpartum as well.
Our community is great to have you. It's really good to have
Absolutely.
someone
Thank
like you.
you.
Hopefully more people get into your field of the OB.
To be able to help us
Yes.
advocate for our bodies. So thank you for what you do and
Thank
helping
you for-
us.
Yes, thank you.
And thank you. Yes. One of the things that you said was advocating, right? Like not even just as you become pregnant, but just thinking about if you're thinking about becoming pregnant, or I would say like as we are educating our young people or, within our schools and everything like that, just thinking about what life looks like outside of like any other system outside of school, right? So I think that's important too as well. But I want to give some tangible pieces that our viewers can take away from our conversation. If you haven't took away all these beautiful data points and personal stories and everything, but like some actionable, tangible things that y'all can do at home. One is getting connected to a local, maybe community organization, nonprofit that centers their work in birthing justice and reproductive justice. We're here in Atlanta. We have Black Mamas Matter Alliance, which is an organization that is rooted in reproductive justice and is led by Black folks. We have RJ reproductive justice groups that center our work in health education and really advocacy. But outside of getting connected to a group, when we speak about personal advocacy or what have you, you can also bring in a person with you to your physician's or your provider's office to advocate for you. So if you're not really quite sure what questions or you want just another pair of eyes and ears or what have you, it doesn't have to be your partner. It can be just someone else you trust to advocate for you and best practices in care. And all you have to do is just sign a release of information or consent form, right? But our providers don't really tell us that, right? So, a part of advocating for ourselves is getting informed, getting information and resources. And this is why we've created our panel, so we can have these dynamic conversations about the resources and information that exists. So thank you so much to everyone who has been here on our panel today. If you need more information about any of the things we discussed here, please visit us at Our Panel TV on Instagram. Slide in our DMs. We'll be willing to answer any questions or inquiries you may have. So thank you again for joining us. Until next time.